Today we are going to discuss about the substance-related disorders and behavioral addictions. This is Unit 11. So we will be discussing today about introduction, important terms related to substance use disorders, alcohol use and dependence disorder, psychoactive substances and their types, opium and its derivatives, depressants, stimulants, hallucinogens, and other types of drugs. Factors of substance use disorders, treatment of substance use disorders, behavioral disorders, that is gambling. So we have learning objectives like differentiate between substance use, abuse, and dependency, explain the harmful physical and psychological effects of alcohol and drug use, describe the etiology of substance use disorder, elucidate treatment and prevention of substance use disorders, explain the nature of gambling disorders. So let us see first important related terms. Psychoactive substances affect the mental functioning by affecting one's central nervous systems, classified as sedatives, stimulants, opioids, hallucinogens, and tranquilizers. Substance use, the consumption of psychoactive substance in moderate amount that does not significantly interfere with social, educational, or occupational functioning. It is called substance use. Substance intoxication, it's like body's reaction to the ingested psychoactive substances, changes in psychological states and physical abilities. Substance abuse, maladaptive substance use to the point that recurring problems are evident. For example, drunken driving is an example of substance abuse. Substance dependency or addiction. So it is a more severe form of substance use disorder characterized by tolerance and withdrawal symptoms, causes a significant amount of distress. Some hallmarks are tolerance, withdrawal, drug-seeking behavior, and relapse. Let us see the DSM-5 criteria for substance use disorder. So, taking the substance in large amount or for longer than you are meant to, wanting to cut down or stop using the substance but not managing to, spending a lot of time getting using or recovering from use of the substance, craving and urges to use the substance, not managing to do at work, home, or school because of substance use, continuing to use even when it causes problem in a relationship, giving up important social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts in a danger, continuing to use even when there has a physical or psychological problem that could have been caused or made worse by the substance. Development of withdrawal symptoms, which can be relieved by taking more of the substance, needing more of the substance to get the desired effect. So, dimensional approach to the use and abuse of substances. So, initial stage is abstinence. The person doesn't take any type of substance. Then it starts with experimental use, then social use, then binge use. Binge use is like occasional use, but a good amount of substance you are using. Then abuse, and it may develop to leads to dependence that could be mildly moderate or severe. So the usual drug use carrier, let us see how the dependency develop. So it starts with experimentation. So experimentation depends upon the availability of the drug, peer pressure, socio-cultural norms, psychological factors. Generally, experimentation starts in adolescent stage. We all know it. So then occasional or irregular use, it depends upon the initial experiences. If the initial experiences were good, then the adolescent may keep on continuing use. And then peer pressure. Then occasional use becomes regular use. So regular use may be abuse or misuse, and symptoms of harm starts appearing at this stage when the person starts taking regular use. Then it may lead to dependence or it become addiction. So at this stage, the person cannot perform activity of daily living without substance, and withdrawal symptoms in abstinence is seen. So what happens? It starts with basically softer drugs to harder drugs. So it may be started with smoking or beer, and then it may lead to use of charas and ganja. Then may go to heroin, smack, and injection, injectable drug use. So tobacco and alcohol is considered as gateway to harder drugs. So it is a basically vicious cycle. So presence makes you feel good. So when you take substance, you feel good, euphoria, etc. And absence, when you don't take, you feel miserable. Withdrawal symptoms may start. So once you start taking substance, so you may trapped in this vicious cycle. So now let us see the types of the psychoactive substances. So we can classify into six category. Depressant, like they give relaxing effects, sedatives, anxiolytic drugs, and hypnotic drugs. Stimulants, like alert, it gives you alertness and increased activity. Amphetamines, cocaine, nicotine, and caffeine. In opioids and narcotic drugs, they basically help in pain reduction and gives you euphoria. Yeah, opium derivatives, heroin and morphine are in this group. Another group is hallucinogens, induce hallucinations. We know hallucination is basically perception without any stimulus. So there are no voices, but still the person hearing voices. Paranoia and delusions, marijuana, use of marijuana, LSD, ecstasy. Other drugs of abuse are like inhalants, steroids, over-the-counter drugs, OTC, anabolic steroid, and prescription medicines. Then another category is behavioral addiction, under which the like gambling disorders, and there are other internet addiction. So let us see the depressant. So how it works? So basically, depressant reduce the activity of central nervous system. So due to this, they are useful in treating anxiety, panic, and sleep disorders. So major drugs are like sedatives, for example, barbiturates, a very strong sedative. Overdose may lead to paralysis of brains, respiratory centers, poor decision making, sluggishness, slow speech, sudden mood shifts. And there are hypnotics like benzodiazepines. They induce, extend, or improve the quality of sleep and reduce wakefulness during sleep. So there are two broad categories of patients who become dependent upon sedative, hypnotic, or anxiolytic medications. Those who take them for symptomatic treatment of a neurological or psychiatric disorders, and those who use them in non-medical settings, sometimes for self-medication for their symptoms, but also to enhance euphoria or curb withdrawal from other symptoms. So, like in first category, it is prescribed by the doctor, but the person keep on taking without further need. Whereas in second category, the person tries to manage his problems, psychological or other problems. So, what are the negative effects of depression? It causes drowsiness, even by the small doses. Motor impairment may be there, motor coordination may be disturbed, impaired judgment, higher accidental risk in first weeks of use, and anterograde amnesia, intoxication, stupor, coma, and respiratory depression. So let us see these things in brief. Like anterior uh, amnesia means if you take that after that for some period of time you may not recall the what happened after that. Intoxication means you are fully influenced of the drug and you may not be aware what is happening with you after the intoxication is over. Stupor is basically you are maintaining a posture. Coma when you are not aware, you are unconscious. And respiratory depression means your heartbeat and pulse rate is going down. So let us see the withdrawal symptoms of depressants. So autonomic overactivity, like autonomic nervous system is become overactive, more heartbeat, more pulse rate. There will be tremors, like the hands will be shiver like this, or it will be difficult to maintain the posture. Insomnia is basically lack of sleep or disturbed sleep. Psychomotor agitation or anxiety, hallucinations, and convulsions. Convulsions like epileptic like fits may be there. The person may have unconsciousness and the tonic clonic movement of the limbs. Then rebound of insomnia, anxiety, or other symptoms, reappearance of a mood or anxiety disorder. So now let us see alcohol use disorder. Alcohol is more commonly used substance, we all know. After tobacco, alcohol is the highly used substance. So, what is alcohol use disorder? So, this can be defined as a state, psychic and physical, resulting from taking alcohol, characterized by behavioral and other responses that always include a compulsion to take alcohol on a continuous or periodic basis in order to experience its psychic effects and sometimes to avoid the discomfort of its absence. Tolerance may or may not be present. Let me explain one thing, tolerance, because this word is coming again and again. So tolerance is basically you have to increase the amount of the substance to get the earlier effect, same effect. Like if you are taking 2 packs of alcohol, you are feeling good, pleasurable effect you are getting. But what happens after some time, you may develop tolerance. So just 2 packs of alcohol will not give you same amount of pleasure. So what you have to do, you are forced to increase the quantity of your alcohol. So you have to go to 2 to 3 packs of alcohol, then only you will be getting same effect. So that is called tolerance. Alcohol is often taken in larger amounts or over a longer period. Then we can make the diagnosis. Then persistent desire or unsuccessful efforts to cut down or control alcohol use. A great deal of time is spent in activities to obtain alcohol. Craving or a strong desire or urge to use alcohol. Continued alcohol use despite having psychosocial problems. Tolerance, withdrawal. Withdrawal means when the substance is not taken, when the alcohol is not taken, the person may have certain physical, psychological symptoms. Physical symptoms like the person will have tremors, shivering, loss of appetite, disturbed sleep, and may have rum fits, seizure-like disorder. Whereas psychological, the person may have craving, the low mood, person may not feel like doing anything. So these are so in alcohol and other substances, the withdrawal symptoms could be lethal. The person may die. So let us see the effects of brain on our body and mind. So let us see the effect of brain on brain. So we all know that alcohol is a depressant. So it depresses some certain area of brain. Its initial effect is that of a stimulant because the inhibitory centers of the brain are initially slowed down. At higher level, it depresses brain functioning by inhibiting glutamate. Higher order cognitive functions like judgment, rational thinking, self control, inhibition, etc., are diminished. Chronic intoxication results in thiamine deficiency. It is a vitamin, thiamine deficiency, which results in Korsakoff syndrome. And it is a syndrome seen in alcoholics if brain is affected more. Perception of cold, pain, and other discomforts are dull. General feelings of warmth, well being, and expansiveness, lack of motor coordination, slurring of speech, the person can't speak clearly, vision impairment, and confusion. So, these are the effects of alcohol on brain. On our body, affects several body parts, directly absorbed from stomach, gets metabolized in liver. Chronic alcohol intoxication results in liver damage. Approximately 15 to 30% heavy drinkers develop cirrhosis of liver. It reduces the absorption of other nutrients inside the GIT and results in malnutrition. Reduces the absorption of thiamine, which results in brain dysfunction and responsible for a decline in intellectual functioning. Let us see the effect of alcohol on psychological aspect. So, so chronic and heavy alcohol intoxication may cause oversensitivity, depression, chronic fatigue, impaired judgment, poor reasoning, changes in personality, loss of employment, affected relationship status. So, so what are the effect of alcohol and how they influence the other functions of the body? Effects due to alcohol depend on various factors like amount of food in the stomach. Like if you take alcohol empty stomach, the effect will be more. You may get intoxication more easily. Whereas if you have taken some food and then you uh, take alcohol, so then the effect may not be that much intense. Duration of drinking, if you are drinking since longer period of time, say for example 10 years, 20 years, so the effect will be more. Then physical condition, if you are healthy, so there will be less possibility of intoxication and the metabolizing rate of alcohol. So all these factors will decide that how fast you will develop intoxication. Psychosis associated with severe alcohol abuse. As we have discussed earlier, Korsakoff symptoms or syndrome, it is basically a psychotic type of symptom. The person may have hallucinations and delusions. So here, if the person is taking alcohol and the abuse is severe, the person may develop acute psychotic episodes, temporary loss of contact with the reality, confusion may be there, the person may not aware about the surrounding, excitement or mania may be there, or delirium may be there. In delirium, the person may have lots of hallucination, visual hallucination like insects are crawling all over the room, in the room or body. Then alcohol withdrawal delirium, disorientation to time, place, and person, vivid hallucinations. They are very clear, extreme suggestibility, fear, hand tremors, fever, rapid heartbeat. It may last for 3 to 6 days, the delirium, and the common cause of higher rate of mortality. So delirium is basically a medical emergency and the person should be treated immediately. So another one is alcohol amnestic syndrome. So memory defects along with falsified memories. Then delusional, the person may be delusional, delirious, disoriented, unable to recognize object and people, linked to vitamin B deficiency, and other dietary inadequacies. Now, let us see the opioids and narcotics. This is opium plant, and chemicals in the opium poppy that relieves pain and induces sleep. So this is used for medicinal purpose. And what happens in our country? It is like permit is given to farmer to cultivate opium. So the land is marked only in this much land can be used for this cultivation, and there will be supervision from the government body. The material should not be diverted from the farms. So, but some of the material they go into the black market. So when this plant is ready, the cut is marked, and the this such type of drops will be there, so that will be collected and used for medicinal purpose, and it is very effective in reducing pain. So generally used in management of pain due to cancer and other severe life threatening illnesses. So active constituents are morphine, other names are heroin, codeine. Mode of administration is smoking, chasing, snorting, eating, or through hypodermic needles. So effects are like initial euphoria, and spasm may be there that may last around a minute and followed by a lethargic state. The dependence potential of heroin is very high. So, like in alcohol, it may develop a dependence around 5 to 8 years. It may take, but whereas in heroin, the dependence may be developed even within a week. If you are taking regularly for 5 days, you may develop dependence. It will be very difficult for the person to live without the um, opioids or heroin. And withdrawal symptoms after 8 hours of last using. It means if the person is using opioids or heroin, so if he has taken first dose in the morning 8 o'clock, so up around 4 p.m. he has to take again the second dose, and third dose he has to take in the night, and this increased very fast. So let us see the what are the diagnostic points to make the diagnosis of opioids use. So the as we have discussed initially, DSM-5 criteria, all these criteria are used for diagnosing these substance use disorder. Only something specific may be related, like often taken in larger amount or over a longer period, as we have already seen. Persistent desire or unsuccessful efforts to cut down or control opioid use. A great deal of time is spent in activities to obtain the opioids, craving for opioids, continued opioid use despite of psychosocial problems, important social, occupational, or recreational activities are given up or reduced because most of the time is spent in procuring opioids and using it, and then relaxing after that. And tolerance and withdrawal symptoms will be present. So let us see now what are the withdrawal symptoms in opioid use disorders. Runny nose. Suppose if the person has not taken opioids for more than 8 hours, so these symptoms may start. Tearing eyes, perspiration, restlessness, an intensified desire for the drug, chilliness in the body and extremities, vomiting, diarrhea, flushing, excessive sweating, abdominal cramps, pain in back and all over the muscles and body, and insomnia. So you might be knowing insomnia means disturbances in sleep. There are three types of insomnia. Initial insomnia, where the person unable to get sleep when he goes to the bed. he may take 2 to 3 hours, then the sleep will be there. Intermittent insomnia, where the person goes to bed and falls to sleep, but the whole night the person may be getting up and then sleeping. That is called intermittent insomnia. And the third one is terminal insomnia, where the person gets up early in the morning before 2 3 hours of his usual time. For example, the earlier the person was getting up at 6 o'clock, now the person is getting up at 3 o'clock. So let us see the stimulants. Stimulants with it stimulates our activity of central nervous system. So, what are the stimulants? They are cocaine, amphetamines, caffeine, and nicotine or tobacco. They are stimulants. So that's why in it is seen that the students, if they want to study in the night, so they have to smoke. Why? Because it makes them alert, or they take coffee. So how it is taken? Ingested by sniffing, swallowing, or injecting. It is costly and is generally used by upper class and affluent members of the society. And like cocaine, it is a party drug, you can say. It leads to a euphoric state of 4 to 6 hours, and acute schizophrenic like symptoms may be developed in addition to depression. So the person may have schizophrenic like symptoms, may have hallucination, delusion, and uh, may have uh, a motivation, not able to do anything, don't feel like doing anything. Such type of symptoms may be there. So one of the most common illicit consumed drug is stimulants. Uh, Methamphetamine is basically a highly used substance in the party. It helps to stay alert and awake and function temporarily at a level beyond normal. Then again, see the diagnosis. Basically, this slide is not necessary, but I purposely put this slide to like it will like easy for you to recall the diagnostic criteria for substance use. Like same thing like taking higher concentrations than intended, unsuccessful attempt to cut down or control the use, spending excessive amount of time on stimulant use, urges and craving, failing in the obligation of home, school, or work, continuing to use stimulants even after psychosocial problems, giving up or reducing important activities. Then again, tolerance may be there, withdrawal may be there. Common reactions of stimulants include high blood pressure, enlarged pupils, unclear or rapid speech, profuse sweating, tremors in the whole body, and excitability, loss of appetite, you don't feel like eating, confusion, sleeplessness, and in large doses, caffeine can make one feel jittery and lead to insomnia. So, among all these substances, caffeine is the uh, l- less harmful than cocaine. But still, there are some harm, and it may lead to insomnia. Those who take caffeine in the evening, it may um, affect their sleep also. So, what are the withdrawal symptoms? Unpleasant mood, drowsiness, headaches, seizures like epileptic like fits, shakiness, anxiety, agitation, insomnia, overactive reflexes, increased heart rate, and high blood pressure. So let us see the tobacco. So it is a poisonous alkaloid tobacco used in cigarettes, chewing tobacco, cigar, clove cigarettes, bidis, hookah, gutka, Pan. So varieties of use of tobacco is there. In a small dosage, it stimulates the central nervous system, reduce stress and improve mood, and it have harmful effects like high blood pressure, increased risk of heart attack and cancer, high physiological and psychological dependence. Withdrawal symptoms may include depressed mood, insomnia, anxiety, difficulty in concentrating, restlessness, and increased appetite and weight gain. So tobacco is basically a leaf which contains more than 4,000 of chemicals. Out of them, at least 79 chemicals are carcinogenic, means they cause cancer. So that's why people are aware that tobacco causes cancer, but still people use tobacco in gutka or so gutka, chewing tobacco, khani, they are the main reason of oral cancer. And they cause basically almost all types of physical illnesses because there are more than 4,000 chemicals, so they attack our each and every internal system of our body organ. So it's very difficult for a person to remain healthy and taking tobacco. Though the people may say that in the village they have seen their grandfather who was using tobacco since long time and he is still 90 years old and healthy. So these are the rare examples, but we do not know what is there inside. But in maximum number of cases, there is a possibility that high possibility that they may develop one or the another type of physical problem, including sexual dysfunction. So now let us see the hallucinogens. They are psychedelics, affect people by either making them feel up or down, change the way individuals perceive the world. Psychedelics do not create sensory images, they distort sight, sound, feeling, taste, and even smells. So, one of the very common type of experience shared by the people who are using hallucinogens, like they may see the sound and listen the picture, hear the picture. So so people basically having such type of experience, they take hallucinogens. So LSD is a very common type of hallucinogens. Uh, a person typically goes through 8 hours of changes in sensory perception, mood swings, and feelings of depersonalization and detachment. Depersonalization, you might be knowing that कि the person feel that कि this is his body or her body, but as if it is changed, as if it is not his or her own body. This is changed. Like this hand is mine. The person understands this, but he may think that the hand is changed. So this is depersonalization. Where another phenomena related to depersonalization is derealization, where the person feel as if the world or surrounding is changed. Though the person understand, yes, everything is same, but he feels that as if everything is changed. Tolerance develops quickly. For most hallucinations, no withdrawal symptoms are reported. Uh, so, if you take hallucinogens, there not necessarily key withdrawal symptoms may be there. Marijuana, it is in our country, it is called ganja. It is basically name given to dried parts of the cannabis or a hemp plant, also known as a street name is weed. So in India, in our country, ganja is illicit substance. It is not permitted legally, whereas the bhang, which is from the same plant, like the bhang plant is there, the leaves, which generally people make paste of those leaves. So it is called as bhang, whereas resins of the uh, plant and the flower top is taken, that is ganja. Hashish derived from the resin of this same plant. So now let us see the effect of hallucinogens. Normal experiences seem extremely funny, or the person may enter a dreamlike state in which time seems to stand still. Distorted sense of time, then heightened sensory experiences like vivid colors or greater appreciation of music. Paranoia in larger doses. Paranoia means you are doubting others, you are having so many thoughts or doubts that other may harm you or other are planning or doing conspiracy against you, and that is paranoia. A strong relationship between daily marijuana use and psychotic symptoms. It has been very clearly seen that those who are using ganja, more than 50% of develop psychotic symptoms. So it has been seen highly used among the college students, and many of them may become motivated and then they don't feel like doing anything. Long-term use of ganja is related to cognitive impairment, lethargy, and passivity. That's why you see the many babas, those who are using ganja, they don't feel like doing anything. They just take the ganja and relax. When they feel hungry, they go to some langar, they take food, and then they again remain lethargy. Sorry. So now let us see the other drugs of abuse. Let us discuss the inhalants. Adolescents from economically disadvantaged families, they used to take inhalants. Uh, what are the inhalants like spray pants, hairspray, paint thinner, gasoline, nitrous oxide, nail polish remover, whitener, and felt tipped marker. So, like earlier, you might be saying that there are two bottles. One is whitener, one is thinner. So now government banned there should not be any separate thinner. So it should be mixed with something. So this all these things will be smelled by the adolescents. Generally, it is highly prevalent in street children, and this resembles that of alcohol intoxications. And frequent usage builds up tolerance. There will be withdrawal symptoms like sleep disturbances, tremors, irritability, and nausea. So basically, these inhalants they affect the kidney and lungs and other parts of the adolescents because they are in the growing stage. So they are highly affected with the inhalants. Other drugs of abuse, steroids, generally taken by the mm, players, by athletes. These are also called performance enhancing drugs. So, sports persons, bodybuilders, models often use them to enhance performance and body size. Some negative effects are reduced sperm counts in male, infertility in male and female, shrunken testicles, erectile dysfunction, hair loss, breast development in male, increased risk of prostate cancer, and severe acne. So the effect are basically affecting the reproductive systems. Now let us see what are the factors responsible for substance use. The exact cause of substance use is not known. However, some of the causal factors responsible for substance disorders are genetic predispositions, drug action or mechanisms like drug potential, peer pressure, emotional distress, mood related problem, anxiety, depression, stress, unhealthy coping strategies, Presence of any psychological or medical illness like major depressive disorder, ADHD, post-traumatic stress disorders, COPD, lungs disorder, etc. Living a stressful or chaotic lifestyle, a familial history of substance use. So we can categorize all these causal factor into three category. Addictive property of the substance means the certain factors related to substance, certain factors related to our heredity, biology called constitutional vulnerability, and certain factors are related to environmental reinforcement and pressures. Now let us see these factors. So all drugs activate the pathway or the mesocorticolimbic dopamine pathway in the brain. It is also called the reward pathway. It is related to functions like control of emotions, memory, gratification. When this area is stimulated, state of euphoria is achieved, thereby reinforcing the use of substance. However, continued exposure to the brain leads to neurochemical changes which result in withdrawal symptoms in the absence of substance. Some drugs have more intense withdrawal symptoms than others. Like opioids have more withdrawal symptoms than tobacco. Biological diathesis, like family studies provide strong evidence for genetic influence on substance use. Molecular genetics studies found that a gene related to dopamine release and reuptake is related to being nicotine addiction. Children of alcoholic parents adopted by non-alcoholic parents were nearly twice as likely to have alcohol problems. Then psychological diathesis, high level of negative emotionality and low constraint, high risk taking and impulsivity are common psychological traits for development of substance use. Other psychological characteristics may include emotional immaturity, higher expectations, needing a lot of praise or reassurance, strong negative reactions to failures, low frustration tolerance, feeling of inadequacy, impulsivity, and aggression. So, all those things make the person psychologically more vulnerable to take substance. Rebelliousness, experimental and sensation-seeking tendency. This is basically seen in adolescents. Greater generalized anxiety, early childhood experiences, and lack of stable family relationship and parental guidance can lead to development of psychological vulnerability for substance use and abuse. And the familial diathesis, like presence of alcoholic father, lack of attachment to father or mother, acute marital conflict between parents, lax parental supervision and inconsistent discipline, frequent moving during family's early years, like lots of transfer, lack of family cohesiveness. And now see the cognitive diathesis. Some beliefs are responsible for making an individual more prone to substance use, like alcohol. Drug use will lower stress and anxiety, increase sexual desire and pleasure, and enhance popularity and acceptance by peers. By contrast, expectations of harm are related to lower likelihood of substance use behavior. Sociocultural diathesis. In many cultures, alcohol use is common as it acts as a social lubricant and tension reducer that enhances social events. In such cultures, alcohol is readily available. For instance, in wine drinking societies, wine is present in many settings, including college canteens, cafeterias, birthday parties, and marriage parties, any other functions. By contrast, negative cultural attitude in certain culture, for instance, in Islamic countries, may be related to low rates of alcohol dependency, same as like smoking is low in Sikh community. Causal factors, environmental reinforcement and pressures, psychosocial stressors. A person must be exposed to the substance, living in an environment that promotes alcohol use or other substance, and experiences of stressors and pressures in life. Now let us discuss the treatment of substance use disorders. A number of programs and models have been developed. First, inpatient facilities are designed to help individuals successfully go through the withdrawal processes, along with support of mental health professionals who provide them with counseling so that they can successfully go back to their family and work life. Outpatient care is relatively cheaper than inpatient care. However, in government hospital, it is more or less free and can also provide effective treatment for substance use intervention. So here, it's not necessary that all the patients should be get admitted in the ward, then only the treatment can be done. No, in OPD basis also, the treatment can be done. The person can be detoxified, the person can be put on some maintenance substitution or maintenance medications, so to manage the withdrawal symptoms. So different types of therapy. Now let us see each therapy one by one: psychoeducation, motivation enhancement therapy, relapse prevention, and family intervention. So basically, motivation enhancement therapy is based on the transtheoretical model. Like almost all persons, those who are using substances, they are in pre-contemplation stage. Means they do not think there is any harm caused by the substance. Then after sometimes they become contemplate. They start contemplating about their substance use. They want to quit. They want to reduce, then they determine and plan, prepare themselves, and then they go into the treatment. Once they go into the treatment, they remain abstinent for longer period of time. However, uh, substance use is a chronic relapsing illness, so most of the patients relapse and then they again go back to these stages. And if the person remain in maintenance stage for longer period of time, say for example 6 months or 1 year, then the termination of the therapy can be done. So what happens at pre-contemplation stage? Like the person does not considering change, so the therapist goal should be to move the contemplation stage. But there are barriers like knowledge of risk or consequences, self-efficacy, contentment. Then here the patient considering change but is ambivalent. So the therapist goal is to move to the determination or preparation stage. Then at this stage, preparation stage, the patient is committed to change within a month, and the goal of the therapist is to move to action stage, so to design the plan and to get the treatment started. Under action stage, the client started behavioral change, and the goal of the therapist is to optimize plans, maintain change, and discuss the motivation. But the overconfidence may affect the this stage, and the patient may relapse. In maintenance stage, the client is maintaining the change, not taking substance, and the goal of the therapist is to make this maintenance stable, teach the new lifestyle, attainment of original goals, like which were not fulfilled due to substance use. Then relapse, resumption of undesired behavior, like after maintenance for 6 or 1 year, 6 months or 1 year, the patient again start using substance in the same older pattern. Relapse is a normal expected stage of behavioral change. So the goal of the therapy should be like identify relapse, reframe as opportunity to learn and re-stress. Termination or exit from the therapy, like a relapse is a highly unlikely, new lifestyle is stable, pre-contemplation about returning to behavior. So now let us see the principles of motivational interview. They are advice, like you have to advise, you have to reduce the barriers, You have to improve the you have to give the choices of getting pleasure from other different healthy things, decrease desirability of positive effect of substances. You have to show the empathy, give personalized feedback, you have to set the goal, and you have to be always open the door for the client, so you are playing as a helping role. There is another technique called relapse prevention. When patient motivation is high, patient is in treatment and abstain for some period of time, so patient should not relapse. So we give relapse prevention therapy. So most psychosocial programs towards the end focus on relapse prevention. Identification of high risk situation and the strategies are developed in advance to deal with these situations along with craving that an individual will feel. Incidents of relapses are dealt as incidents that can occur instead of a globalized sense of failure that may inevitably lead to more substance use. Stress management can be taught relaxation training for stress management, breathing techniques, meditation, yoga, exercise can be taught to the patient, or they can learn from the different meditation programs. So breathing exercises is the simple to reduce the stress. You can also practice this exercise like sit or lie down in a quiet place. Pay attention to your breathing. Every time you exhale, say the word one quietly to yourself. If one thought come, return to your concentration to the word one. Do this for 10 to 20 minutes twice a day. Now let us see the behavioral therapies. In general, most programs involve some form of aversive therapies where the substance of abuse is associated with aversive stimuli like a painful shock when drinking a glass of alcohol. The goal is to replace positive associations that an individual have of the substance with negative associations. Another behavioral strategy is that is contingency management. For instance, in one study, cocaine negative urine sample was rewarded with cash vouchers. There are community-based approaches. So substance abusers are helped to identify a spouse, friend, or relatives to be part of the relationship therapy that may help to improve the relationship with important others. Then there is called Alcoholic Anonymous group, where the patients go and spend 1 hour daily. Clients are given assistance with employment, education, and finances to help reduce their stress and improve their overall functioning in life. Finally, new recreational activities are discussed and encouraged to replace substances that would previously help them feel good or de-stress. Coming to behavioral addiction, this is our last part of the presentation. So now let us see the gambling disorders. Gambling has a long history. For instance, in Mahabharata and several religious uh, books we have seen. Some countries have legalized gambling. Gambling disorders involve continuous or periodic loss of control over gambling, a preoccupation with gambling, and with obtaining money for gambling in spite of adverse consequences. In DSM-5, gambling disorders have been classified as a behavioral addiction. Gamblers also experience craving similar to substance abusers. So, gambling takes many forms: casino gambling, bets on horse racing or sports like cricket betting, internet games, number games, lottery, etc. It affects an individual's social, psychological, familial, and economic well being. What are the causative factors? It is a learned behavior that is highly resistant to extinction. Many experienced beginners luck. This is a variable ratio schedule of reinforcement given by Skinner, where the individual learner learns to give high and steady rate of response, expecting that he would be rewarded, and makes it extremely difficult for an individual to give up. Pathological gamblers share some personality traits. They are rebellious, immature, thrill seeking, superstitious, antisocial, compulsive, and impulsive. Such impulsive behavior is related to some brain mechanisms like motivation, reward, and decision making. So, what happens in gambling? The person, like, there is a always possibility of winning. So the person keep on like betting or putting money into the game. Why? Because there is always chance of winning, even though he is losing money. So there is no fixed ratio interval schedule. So the person is always tend to bet. So how to treat this disorder? So pathological gamblers exhibit denial of their problem. It means they do not accept that there is any problem. Like they are in pre-contemplation stage. Impulsivity, they are impulsive. So it's very difficult for them to not to bet, to not to put money in gambling. And they resolute optimism. So CBT has been popularly used. So let us see what CBT can do. So CBT involves setting financial limit. So it's like difficult for the patient, but the things can be discussed, like how much finances can be put in gambling, how much amount of money can be used for the gambling. So the limit can be set. So like every day you cannot put more than 200 rupees, because there will be always temptation to put more money, even though there is no win, the person is not earning. So the person may take loan from the others. So those who are in gambling disorder, they are having heavily burdened with loan, because they have to pay so much interest. Planning alternative activities. So because gambling give them thrill, so this is the job of the therapist to discuss with the client when he was not having this disorder, how he was getting thrill, how he was enjoying, how he was using excitement. Okay, so like watching movie or playing certain physical games, or telling stories to children, or playing with students, um, or children, or going for excursion tour, uh, going attending some family functions, visiting relatives or friends. So all these things can be discussed with the client, but therapy should not suggest any alternative activities. It should come from the patient. Then only it can be implemented. Then preventing relapse. Relapse should be prevented. So the plan can be like, if there is a possibility of getting more money, so that can be discussed, how this money can be is invested, or how this money can be saved. Then imaginal desensitization. So like the person is like in imagination, the person is taught that the person is they are playing, they are gaming, but the person is just watching, not involving in the game, not betting, even though he's thinking that there is a possibility of winning, but still the person do not put money. And there is a group called Gambler and Anonymous, like Alcoholic Anonymous, where all the alcoholic meets every day or once in a week. The same way, gamblers, they also uh, meet once in a week or once in a fortnightly. Thank you.